So recently, actually, we published in the newspaper a few articles also stating the same that
Yes.
uh, in florid COVID phase, sometimes it's not possible to operate. So
Right.
unless it's like a dire emergency when the patient is actually suffering from the symptoms, he's undergoing treatment for that, we can't operate.
Hmm.
But if he has had COVID already,
Hmm.
then the treatment remains the same as it is.
Yes.
What usually we follow the protocol is once the symptoms get over, we repeat a COVID test at 14 days and at 21 days.
Oh, okay,
And
okay.
nowadays we have something called as the antibody testing also to give an idea regarding how much the antibodies have developed.
Right,
We
right, right.
also do what is called as HRCT, high resolution CT scan,
CT scans.
because the lung changes are the ones which are very sensitive. And
Correct.
also, if the lung changes are not good, uh, they can affect the post-op recovery of the patient also.
Oh
So
my, yeah.
once the patient has already had COVID
Hmm.
and the swab at 15 days and 21 days are negative, and if
Hmm.
the HSCT is fine, he is at par with the other patients.
Okay.
So it's
Okay.
like in the last month itself, we have operated 4 such patients like that, and
Okay.
the post-operative was as good as a normal patient.
Right, 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 right.
So unless some stigmas in the chest,
Hmm.
or like the drugs like those tocilizumab, which can
Yeah, yeah.
affect the WBC counts, or the it affects the inflammatory pathway, as they say.
Okay.
So some patients do sometimes take a longer time to recover, but at least the patients, even Tata Hospital has published their data, which they have shown that even in post-op COVID patients,
Hmm.
in a very complex surgery, the recovery was the same like any other COVID patient.
Okay.
So at present, we are taking like in OPD, we take precautions. Like we use a shield mask, we wear a disposable gown to examine the patients.
Yes, yes,
We are
yes.
segregating patients in the OPD. We are keeping social distancing.
Hmm.
Without mask and without temperature checks, there's no entry inside the hospital.
Yes.
So in OPD, we don't ask for the mandatory COVID test, but we take precautions so that there's no cross contamination, there's no cross infection.
Hmm.
And once the patient is planned for treatment, then we do a COVID test 2 days prior to admission,
Okay.
so that the report is available on the day of admission.
Okay.
And for the complex surgery, we also do the HRCT.
Yes, yes, yes.
So if both are negative, we take them up for surgery or chemo or radiation.
Okay, okay, okay.
In chemo, if the patient is having a weekly chemotherapy and patient is staying in the house for the 7 days,
Hmm.
we don't repeat the COVID. Usually in chemotherapy or radiation, it is repeated after every 15 days or 3 weeks.
Wow,
In
right.
surgery, we just need to repeat it one off.
Yes, yes.
So it's
All
like,
right. So that is how the COVID patients are taken care of when it comes to their cancer as well.
so we are taking a good amount of care is taken, and the best part is even after you have had COVID, uh, the cure and the side effects are the same. So they
Okay.
behave like a normal cancer patient only.
Okay. So it is not like it doesn't affect the cancer
Yes.
patient any other different
So
way.
my advice would be for the patients not to delay their treatment. So
Okay.
we have had few cases during May and June where
Okay.
we have delayed treatment from March to May, June.
Because of the COVID, yeah.
Yeah. So a 15 days delay will not harm you, but a 2-3 months delay can definitely affect the survival.
Yes,
And
yes.
like even if the patient is COVID positive and it is a fast growing tumor, then what we do is like we keep the patient in the hospital for 15 days.
Hmm.
Then after recovery, 7 more days we keep the patient in the hospital only. Within 15 days after recovery, we take them up for surgery.
Okay,
So only
okay.
in very fast growing tumors. So that's a very uncommon occurrence. But
Hmm.
as I said, the standard procedure is 15-day one COVID, 21-day another COVID test. If complex cases, HRCT, and then we operate.